Here are my 4 need-to-haves and 2 good-to-haves that will immediately let you know that you're dealing with the right physio. Number 1 is making an attempt to understand your goals. You literally cannot do your job as a physio if you don't understand the expectations of the person in front of you. I personally struggled with this as a young clinician, particularly in my pre-physical therapy years. As an athletic trainer, I was so focused on trying to get my hands on and figure out the issue. They would give me a couple of sentences about what was going on, and then I would just start spouting off medical jargon without really answering their question in the first place.
Okay, well, check this out, though. First of all, you're throwing too many big words at me. Okay, now, because I don't understand them, I'm going to take them as disrespect.
Even sometimes by the end of the treatment session, they would repeat one of the first questions they asked in the beginning. And the problem was that I didn't actually understand the reason the athlete was there to see me in the first place. And the way to gather this understanding really well is through a good, thorough subjective history. The subjective history, in my and many others' opinions, is hands down the most important part of a very good evaluation. This is where the physical therapist should start to establish some credibility and build rapport. It should be immediately apparent to you that they're asking questions pertinent to your specific goals that they identified very early on. And ideally, you as the patient should be talking way more than they are. And they should be super engaged with a lot of follow-up questions. You should feel that they have a good understanding of your pain and discomfort. Aspects like how severe your symptoms are, how long it takes for your symptoms to come on versus how long it takes them to subside. They should want to know exactly where you feel symptoms, what the symptoms feel like, how often they feel that way and during what times of the day. What's your training history? What's your typical volume? What's your life like outside of wrestling or jiu-jitsu or Muay Thai? How stressful is your job or your home life? And if these variables aren't discussed and the subjective interview takes like 10 minutes, you should probably look elsewhere. A good movement exam is the next need to have. If your physio doesn't do a movement exam, then what the hell are you even there for? Our knowledge of movement is arguably the bread and butter of our profession. And I'm not talking about taking you what seems like very plain ranges of motion or lying on the table to move you around, although those things can be very important. What I'm talking about, if it's appropriate of course, is having you move through positions that are and aren't painful to better understand the capacity to move in the way that you wish. Potentially testing a treatment and then retesting those movements to see if your symptoms decrease, or offering different similar variations of movement that offload certain tissues and decrease irritability. If you only stay on the table with the physio moving you, or even worse, you don't even do movements that are particular to your sport, the physio is probably not right for you. The next need to have has everything to do with the information that you'll be carrying with you after the initial evaluation. After the exam, the physio should give you very clear information on what to do, how to do it, and most importantly, how it gets you closer to your goals. This includes how long it might be expected to take, how much pain is okay to train through, how often to do or not do these things, education on the properties of tissue healing and on pain itself. If you leave the physio's gym or the office and you're not crystal clear on the plan moving forward, then your spidey senses should start tingling. Like I said, the most important part of the evaluation is the subjective history. But as physios, our most powerful tools are our ability to build rapport and educate. This comes before all of the cool manual therapy and any of the crazy exercises every day. All right, so now let's get into the good to haves. These are characteristics that will make your experience with the physio much more positive, but that aren't completely necessary when finding a really good PT. The first is a physio that has or actively participates in your sport. If you do jiu-jitsu, boxing, wrestling, judo, it definitely pays to have a physio who is familiar with the lingo and the culture of the sport. For example, if you do jiu-jitsu and you tell your physical therapist that you have pain in your hip when someone's trying to pass your guard, if you need to explain what the concept of the guard is to them, it probably won't be that big of a deal, but it will take up some potentially valuable time. If the physio already knows, they can follow up with questions like, oh, you mean like whenever they're pressuring your knee down during a knee cut, or when they're using their gi pants to pull your legs around them like in a toreando? That immediately takes a step in the right direction from a rapport building perspective and from understanding the mechanism of injury. And now if they've never done your sport or actively participate in it, the second good to have is a physio who's a former athlete or actively participates in sport in general. Athletes just have kind of a different mentality whenever it comes to things that they like to do. And a lot of times this can go a very long way with the empathy that's sometimes needed when trying to understand the impact that it has on your lifestyle. I've had patients that use their sport, many of them combat athletes, as a way to sort of self-medicate. They've literally been able to come off of their medications for whatever mental health condition they may be battling by participating in their sport. Whether this is a good or a bad thing is not for me to decide. However, understanding the gravity of the situation and realizing that this is another potential stressor is something that's more easily understood if your physio also knows what it's like to not be able to participate in the sport that you love. All right, so let me be clear before I sign off. I'm sure a lot of you have had really good experiences with physios who may or may not have done a few or all of these things. This is just my opinion based on my experience as a physical therapist, how I've personally seen physios presenting themselves, and how physios that I look up to treat their patients. And another quick thing, this obviously doesn't apply if you're just asking a physio for their brief thoughts on a small injury. This applies mainly to whenever you've made an appointment to go see them at their office or their gym. Let me know you guys' thoughts in the comments. Thank you guys for watching, and I'll see you next time.